Hi, this is Dr. Germano from Restore Orthopedics. Today I'll talk about a common spine condition that will affect people with increasing frequency as time goes on because of the devices that people now are attached to, such as cell phones, tablets, laptop computers. And it's not the devices that cause this condition, but it's a change of posture that people don't pay attention to that leads to this unfortunate condition. So I'll start this presentation by going back to the anatomy. This is a model of the neck we call cervical spine. We'll look at the individual bones called the vertebrae that make up the neck, and they are separated by these shock absorbers that we call the discs. The outside of the disc resembles a tire in your car. It's fibrous, tough, and strong. The inside of the disc resembles something like toothpaste or crab meat and is responsible for absorption of shock when we run, when we drive our car on bumpy roads so that our eyes don't rattle. These discs also act as joints, and they also act as spacers, allowing for these nerve roots that come out of the neck and go into our arms to live in a happy, small opening without any compression. As the disc degenerates, the distance between the two bones becomes less because of thinning of the spacer, and the hole where the nerve leaves becomes smaller in its diameter, causing compression of this nerve. And that typically can show up as numbness or weakness of the hand, and if it's not treated properly, it can progress to loss of function in the hand. It can lead to muscle atrophy or muscle degeneration, and if it's not dealt with, one can lose ability of their hand function. So to describe this condition called a Texter's neck, I will turn your attention to an MRI image, and there are two images on the screen. One on the left is an image of a normal person, and this MRI is for the most part normal. This is someone who's slightly older than 45 years of age, and this image by the MRI machine was obtained by taking slices from left to right, and when the image came to the middle, the 3D image of the person was split up like an orange that was cut right down the middle, and this image was obtained to show the inside of a person right down the middle. At the top here we have a portion of the brain that continues on to become a spinal cord, which is this gray rope going all the way down. And the brain, as we know, swims in a fluid called cerebrospinal fluid that continues on with the spinal cord. The neck vertebrae that we talked about earlier are in the front here, and they are separated by these discs. And I said earlier that the outside of the disc resembles a tire, which is the dark part, and the inside of the disc is slightly brighter because of the water content. And there is very slight disc degeneration, but rather minimal, and this person has no symptoms. In the back here, those are the back structures. This is the skin and some of the fat. Those are the muscles, including the trapezius muscle as it attaches to the base of the skull. And what I would like to point out is a curve in the neck of a person who has no problems and has an otherwise normal neck. We call this curve shape lordosis. This is cervical, also known as neck lordosis. This is a normal curve. The reason we have this curve is to minimize the forces acting on these individual discs by distributing them evenly. This curve doesn't just exist in the neck, it also exists in the low back. The problem occurs when we lose this normal lordosis by looking down when we sit or looking at our tablet, and what happens is this curve is lost and the neck straightens. The straightening of the neck and the weight of the head that is transferred by looking down places larger forces on the central and bottom discs of the neck over time, leading to their degeneration. And so when we turn our attention to the image on the right, we'll notice that this is a person, this is an actual patient of mine, a young lady who has problems related to frequent texting, frequent computer work, frequent reading due to a poor posture. This can no longer be fixed with physical therapy, chiropractic manipulations. This curve will not go away until it's dealt with in the future surgically, should she have problems with her hands. And the reason is disc degeneration. Texter's neck leads to disc degeneration. If you look at this central region of the neck, between the vertebrae, we have discs. And this disc in particular has degenerated quite a bit, and she lost the normal lordosis due to the pressure on the disc, which has degenerated, and the curve cannot return because the disc is gone. And so you notice that majority of her discs in the neck are degenerated. How do I know this? Because the disc at the bottom, the only healthy disc in the neck that she has lots of brightness, which indicates high water content. So this nuclear material, the nucleus, is healthy because it has a lot of water. The nucleus in other discs has dried out. The disc has forever changed in its appearance and will likely continue to degenerate. What does this look like long term? If this lady continues to go out about her business and continues to look down, eventually she'll develop a condition known as radiculopathy, and this shows up as numbness in the hand, weakness in the fingers, and inability to perform work. And that happens because this disc that acts as a spacer will shrink. The distance between these two bones, the vertebrae, will become less, and the diameter of this hole, which relies on the height of this spacer, will decrease. So the hole will shrink. Where this nerve leaves, this opening will decrease in diameter, causing this to be choked and compressed. Over time, this shows up as numbness in the hand. Over time, it will lead to muscle dysfunction, muscle atrophy, and require surgery. The surgery is done to restore the function of the hand, and it can range from a small little fusion to something very extensive. What does something extensive look like? Something extensive looks like this. If you notice, this lady started off with degenerative neck disease. She then required a fusion at one level. The vertebrae below and above the fusion eventually also degenerated along with the discs, and so she required an extension of the fusion from the front and the back. This is all because of disc degeneration, and ultimately it can be traced to poor posture, placing great forces on individual discs rather than spreading these forces equally among all the discs in the neck. Hopefully, this will be a motivator for you to change your posture, not to look down at your phone, look up, have your shoulders back, and support your elbows. So to continue with the topic of Texter's neck, I'd like to turn your attention to a muscle called trapezius. If we can zoom in on this picture, trapezius muscle attaches to the shoulder blades on both sides, attaches through all the spinous processes of the spine in the thoracic region, but it also attaches at the base of the skull. So how does a poor posture contribute to degenerative neck disease? So to demonstrate that, I'd like to use Katie as my model. We'll have her step forward and turn around, and this resembles the muscle on the picture. And when Katie's standing upright in a normal anatomic position, the muscle attaches here to the shoulder, runs down here, and runs across here. And so when we have her sit down, as she is a typical worker who works at a computer, and we'll turn the monitor toward her, we'll have her do what typical worker does, which is slouch. So she's going to slouch down like this, forward, and that causes stretching of the trapezius muscle here. And we're going to have her rotate her shoulders forward, that causes stretch of the muscle here. And then finally we have her look down at the keyboard, and that creates a lot of tension along 3 planes of trapezius muscle. People frequently develop trigger points along the shoulder here, trigger points along the shoulder here, and trigger points here. But more importantly, they have a lot of pressure on the discs in the neck, which are in the front of the neck. And so to fight this, or to prevent that from happening, what we have to pay attention to is a proper posture while sitting and working on a computer. That posture is, you have to sit back and straighten your spine out. Look straight and recreate a normal anatomic curve. And most importantly, you have to rest your elbows on adjustable armchairs. Look what happens when you lift your elbow up to the trapezius muscle. It suddenly loosens up. There's no tension in the trapezius muscle, and that tension is not translated into the neck because the trapezius attaches to the base of the skull and the shoulder. And when it's stretched, it puts a lot of vertical forces onto the cervical discs, which are located here in the neck. So to properly sit and work at a workstation, lean back, look slightly up, and elevate your elbow rests as high as possible so the tension in the trapezius muscle is greatly reduced. So this is what I call a diamond stretch to unload the tension in the trapezius muscle. Trapezius muscle gets used and abused all day long when someone works at a computer station or looks at their phone all day. And to unload the muscle from chronic stretch, tension, and injury, this is my favorite exercise to prescribe for patients. Notice Katie's lying face up, her chin is elevated, and she's making a diamond shape with her hands. Her elbows are touching the table, and she is taking deep, slow breaths in and out, and I recommend that to be done for at least 5 to 10 minutes, at least once a day. And the optimal time for this is in the middle of a workday, say during lunch, to relieve the stress to the trapezius muscle that has built up during the early hours of the workday.